Hi friends, I have the honor of introducing to you Dr. Arnav Aggarwal. He is rank 9 PGI Chandigarh, November 2018. It is an awesome performance. Arnav, how are you feeling today?
I'm feeling very nice. It has always been my dream to get a good seat in central institutes, and PGI is one of the best institutes in the country, and I got a rank 9 all India exam. So nothing could be better than this.
Are you enjoying yourself now that we are taking your interview today after a top rank in top 10 rank in a central institute?
Yes,
great,
yes,
great.
It is very much.
Very good, very good. So it's such an honor and such a pleasure to see you doing so well. And I remember that you joined us in your foundation course.
Yes, sir. Yes, sir.
So when you came for the foundation course in your 6th semester, and this is something unique this time I have seen, and I want to advise all listeners also that this time we have seen that most of the people who are doing well in the central institutes, they joined us early in the 2nd year or 3rd year, and that is very important to notice that you can't delay it. If you are aiming high, if your ambition is high, please start early so that you can build up your concepts well.
So definitely starting the preparation early is always helpful, because I started my preparation in my pre-final year, in 3rd year, and I went to regular dams coaching classes on every weekends, and they helped me made such high quality notes, which I was able to revise very quickly. And moreover, on top of that, whenever you are preparing for profs, studying the standard textbooks, you can always add on the things you want from the textbook into that notes. If you start your preparation late, then that option is lacking, because in the end studying the textbooks is very difficult.
Plus the leisure also goes on, like when you have time, you are at leisure, you have time to enjoy the study, enjoy the learning activity. So
yes,
I feel that that has a very significant role to play to start early.
Yes, sir, definitely, because it is a very long study. It is like a marathon. You can't just go in the end and like I'll do it in 6 months or 7 months. So getting a good rank in central institutes, you have to prepare very well, and the earlier you start, the better it is, because you can go at your own pace very comfortably.
And I also want to know that when you entered DAMS at that time, like then did that orient you to the concept of PG entrance? Did you realize okay, this is the way I have to study, this is way I have to follow?
Yes, sir, definitely. The guidance which the teachers gave in all the classes and in the individual subjects was very helpful. They actually oriented that these topics are important, and you have to study like this, and it was not like they just came and teach and went away. They actually guided us ki ye padhna hai, wo nahi padhna. It was very helpful.
And I see there are two kinds of students, one who are good listeners, one who are good notes maker. What kind of student were you in that foundation year?
So I think one has to be both. You have to listen and you have to make good notes, because there are many things which you listen and it stays in your memory forever. There are many questions in the exam I can actually recall that teacher taught me in the class, and it gets stuck in the mind. And making notes is also very important, because not all things you will remember in the class, and you have to keep on revising those notes. And if you make good notes, your revision would be better.
And then you followed it up with a test and discussion in internship.
Yes, sir.
And how did you like the change in pattern from, like in foundation we teach, in test and discussion we give a test followed by discussion. So how did you like the pattern?
So test and discussion, most of all, it gives you a set schedule that you have to complete this subject in 1 week, 2 week, 3 week, 4 weeks, whatever the schedule is, and it helps you complete all the syllabus till in August or September, and you get 2 months for revision after that. So it is very helpful. Plus you give the test and there is a discussion. You come to know about your weaknesses, that even this particular subject, this topic I don't know very well, so you have to go and read the topic, read the test and discussion. It also helps you giving some new updates, because many new updates come regularly, especially in the clinical fields. So they actually help us very much.
So if I say that in TND helped you to get the updates.
Yes, sir.
And plus it helped you to find out your weaknesses.
Yes, sir.
And did you consciously go after each test and look at what you have done, at least from the notes once?
Yes, sir. Definitely. Otherwise, there is no point of going to test and discussion batch if you don't come and revise the notes you have made in that discussion and don't see your weaknesses.
The entire idea of the course is like this only, that you have to, once you have studied, even after you have studied, you will make mistakes.
Yes,
and
sir.
that is what you have to learn, that why that mistake happened, so that you don't make that particular mistake in the real exam.
Yes, sir.
Anybody who makes less mistakes in the final exams get a better rank.
Yes,
and today I think that is the scenario with
yes,
the
sir.
doable exams. You have to make less mistakes
Yes,
to win.
sir. It helps to decrease your silly mistakes very much, because there are many questions like some calculation mistakes you have made, or in DAMS also conducts many online tests. It also helps you orient to aim at especially the AIMS exam, because it is on the computer only.
Did you utilize that grant test, subject-wise test that we do, and the previous AIMS papers that we have given? Did you utilize them?
Yes, sir. Yes, sir. I gave many subject-wise tests and grant tests. They apart from the TND, they give you a lot of many questions to get practice, because the more questions you do, better you will perform in the exam. That is for sure. You can't go and I'm doing theory only without doing questions. And subject-wise tests, grant tests, they actually help you. Apart from the TND, these questions are actually important.
Did you give the CBT test that we conduct as well?
Yes, sir. I gave the CBT tests.
Were you happy with the, that you could go into a real kind of a scenario? And I think we are the only one in the entire country we conduct the test in a real environment of the exam. So did you enjoy that?
Yes, sir. Very much. Actually,
what was your rank?
So I got rank 17 CBT.
Yeah.
It was a very good feel that you get mentally prepared for the exam, of giving the exam in the computer in a proper secure environment. So actually it is very important to give the CBT exam, and it tells you at what level you stand among the country, because CBT is conducted all over the country. So you get to know that, okay, my preparation is going fine. I just have to go give the final push.
And now if I take you a little bit further into PGI preparation in particular, because you have a rank 9 in PGI Chandigarh. So what was your strategy during the exam? Like everybody talks about that, in AIMS, we have talked to all top 50 rankers. In AIMS, everybody talks about being more aggressive, attempting more than 190, more than 195. While in PGI, because the negative marking is higher, everybody talks about being more conservative. So out of 1250 choices, how many choices did you mark in PGI Chandigarh?
So I marked around 550 to 600 choices, because all the teachers recommend that there are only about this many correct options only out of the 1250. There are around 550 to 600 options only that are correct. So if you mark like 800, then definitely you are going to get more negative marks, even if you do all the correct answers perfectly. So you have to be a bit conservative in your approach and mark whatever you feel is correct. Don't be like कि तुक्के वगैरह कम मारने चाहिए उस पेपर में एक्चुअली में.
So out of the 1250, I usually feel, and at this time and the last time also, and having talked to many people who have done good in these exams, it is like 600 plus minus something. Like it is that is somewhere there is a magic number.
Yes.
Nobody really knows, but 600 plus minus maybe 20, maybe 580, 620 is usually the correct number of answers. Huh? Again, I also want to know that, just before 1 week before the PGI exam, like you had a AIMS exam that you had 1 week in between. Did you use that 1 week for something specific when you were preparing for PGI Chandigarh?
So in that 1 week, I mostly read the previous year PGI papers only and revised some topics that I felt I was lacking while giving my AIMS exam. Apart from that, there was not much to do, because there are only 5 days left, and you have to travel also for 1 day.
Maybe so if I say that last 1 week was your prime focus was to look at the things that you've done wrong in the previous exam.
Yes, sir.
And second thing was you were looking at the previous papers of PGI.
Doing previous papers is very important for both the exams, AIMS and PGI actually.
Any topics that you feel that they were stressing on this particular exam that you gave?
So like in PGI paper, I have seen that they don't don't generally ask very high-fi things. They ask the basic things, but in much detail, because you have to see each and option individually. Like there were around 3-4 questions in Down syndrome. In one paper only there were 3-4 questions. In pharma, like there were questions on simple cardiovascular drugs only. So
But
you just have to
because
stick to the
more than
basics.
one is correct, so you need to know them thoroughly.
Yes, sir.
That is a difference, I
Yes,
think.
sir. In PGI, they will ask the basic things, but you have to know them thoroughly. That is the main key.
In AIMS, you may get away with, knowing the most important side effect, but here, if they say which of the following is a side effect of the drug, you need to know all of them.
Yes, sir.
Because that kind of that differential approach to the things is required in PGI Chandigarh.
Plus, you don't go have to rare things. They will ask the common things only, but you have to do common things thoroughly.
Any more recommendations that you have for future aspirants, that anybody who's aspiring to do well in PGI Chandigarh, any more topics you want them to read, or anything that you want to stress upon?
Actually, I am not able to remember exactly what all.
I think plus I think PGI is an exam which you forget very fast.
Yes, sir,
because of the travel and the more than one answer correct.
There are around 250 questions, and you have to go do it in 3 hours, and it is like just see and click, see and mark the answer, see and mark the answer.
And
you can't think a lot.
Yep. Another thing that I would like to use this opportunity to tell all the listeners is that PGI exam is poorly recalled. It's very important to understand. So sometimes I see some students, they go totally crazy about what a recall guide has written, and sometimes those words are not making sense. So have faith when we tell you that okay, this will not be asked, because sometimes those are not properly recalled. It's very difficult to recall all 5 choices. So that is why PGI guidebooks have maybe I would say 40% accuracy or 50% accuracy, not more than that. So but still they are important to do. Still it is important to look at last 3 years, 5 years PGI papers,
Definitely.
because PGI Chandigarh there is a tendency to topic repeat. And how would you compare? You have done well in the AIMS as well. You were telling me you had a rank 48 in this AIMS exam. So, how would you say, approach to somebody aspiring to do well in both the exams? How does the approach differ?
PGI exam is more of a knowledge-based exam. You have to acquire as much knowledge as you can get on the simple topics. In AIMS, it is like they will give you a clinical scenario, and you have to actually think in the exam what is the next step and what is the better diagnostic modality in this exam, regarding to this question. So it is for AIMS, you actually have to go to the clinical postings and all, apart from doing the theory, because they will actually help you to get oriented to real life situations. But doing theory, there is no alternative for preparing for any exam without having a good theory.
And AIMS would have that many visuals as well, and this time they had videos as well.
Videos only.
While PGI is a pen and paper exam. Any particular thing that you did to you thought consciously that this is a pen and paper exam, or any particular thing you to keep in mind for future aspirants?
One most important thing is like students might think that they will first tick on the question paper and then attempt at the end.
That's a big blunder.
No, so it can't be done, because in the end you will not get enough time to mark all the options that you even know also. So the most important thing is see the question and mark it side by side only. It is
any particular teachers that you remember in DAMS?
So first of all, you is very good radiology, and Deepthi ma'am. So apart from that, I got Deepak Arora sir for ENT. So he had a very good grasp on especially the anatomy part, because in ENT, ear and nose anatomy, understanding and visualizing anatomy is even very difficult, and he helped me a lot. Tushar sir for ortho, Arvind sir for medicine. Like he actually guided me how to study medicine, like Harrison or anything. That you don't have to go crazy about the book and do everything. Just see the important topics that he taught in the class. Just read that topic from the book. nothing else.
Would you say that, making notes early on in the preparation when you came to us in the sixth semester has paid you dividends today?
Yes, sir, definitely. Because while preparing for profs, while studying the textbook, you can add some things in the notes. Although I don't recommend that you add a lot more things, that it gets a very, very bulky notes and you are not able to revise only that. And there should be a differentiation between what the teacher taught and what you wrote, like with a different pen. Like it will help you in the end, because in the end, if think you have left less time, then you can revise the things which are taught by the teacher only.
That's very important. I personally recommend that, whatever we teach, if you can keep that copy aside, and whatever you want to add, you can add in another notebook. So what happens is that helps you to be very clear in the end that suppose you have less time, okay, this is what the sir has taught me, at least I can do this much. Because sometimes I see students, when they are doing a lot of guidebooks, they keep adding all that guidebook questions without any idea if it is right or wrong. They keep adding in the notes and then they get confused. So sometimes the student comes back to me, sir, you taught me in the class, I have written this in the class notes. I said, I never taught this in my life. You have written it your own self. So it is very important to, make sure there is a clear differentiator.
Yes, sir, actually.
If anything that you are adding in the notes, it should be clearly visible so that you are able to utilize them. Now, I would now take this, put you in a corner and give you a task that, say something motivating to future aspirants.
So always be confident. Be confident that you are going to crack the exam, because in this it is a very, very long study and you will lose confidence in between. So you just have to talk to people and keep motivating yourself to study hard. Nothing is better than perseverance, and your attitude is most important for the exam.
So attitude will take you places. Keep going on is what
Yes,
he
sir.
says. Keep moving on. You may have some defeats in between, but keep moving on.
Yes, sir.
So with this, I would conclude this interview by wishing you all the best. I again congratulate you on your exemplary achievement of getting a rank 9 in PGI Chandigarh. I would also take this opportunity to congratulate your parents. I'm sure they must be very, very proud of your achievement.
Yes, sir.
May I ask you, which branch are you going to take?
I have to actually decide. I'll see in around next 10 days that what branch I'm going to take.
You're still thinking about it, and I'm sure you'll make a great decision. God bless you. I wish you all the best.
Thank you, sir.